All right. Good afternoon, everybody. I'm excited you're joining us today. We're going to talk about vestibular therapy, balance therapy, and some of the concussion therapy that we do. Now, this is an area of specialty that I am really passionate about. I've been doing this for a little bit, and so I'm very excited to be talking to you guys today. All right. There will be a chance for questions at the end, but if you have a question at all during the presentation, go ahead and type it into your chat feature, which if you move your mouse or finger on the screen, at the bottom, you'll notice a little chat bubble that pops up. If you click on that, you can type in a chat. Dr. Hobson will be monitoring the chat for me, so she'll let me know if there are any questions. But at the end, like I said, there will also be a designated time for you to unmute yourself and go ahead and ask questions, okay? All right, I'm going to start my screen share. Okay. Can everybody see the webinar?
Yes.
Awesome. So again, this chat is about vestibular, balance, and post-concussion treatments. We also identify a couple of the causes and give you some examples of some of the treatments we do. We are part of Physio Partners, in case you didn't know that. So keep that in mind for us, okay? So our objectives today, I'm going to be telling you what some of these vestibular, balance, and post-concussion syndromes look like, indicate when you should start to think about getting some help, and I'm going to tell you a little bit about how physical therapy can help treat these disorders, okay? That's including vestibular therapy, balance exercises, and post-concussion treatment. And at the very end, I'm going to tell you a little bit about what to expect if you come in for an evaluation. All right, so getting right into it. So what do vestibular disorders look like? Well, one of the most common vestibular disorders, and one of the ones that everybody kind of thinks about when they think of a vestibular disorder, is your classic case of vertigo. Now, that's kind of described as sudden, intense spinning. It really does look like the room is just spinning around you and you feel your eyes moving. This causes intense dizziness, unsteadiness on your feet. It can really incapacitate you. This commonly occurs when you're laying in bed. Maybe you had laid down from a standing position and you feel that intense spinning. It lasts about 30 seconds to about 2 minutes. Other times it can be turning over in bed, or maybe you're bending down to pick something up. We're not really fully sure why this happens. Sometimes it's random. Some people are just, kind of luckier than others, unfortunately. There's a little bit of a genetic component to this, and also head trauma. If you've recently had a hit to the head or a fall or something like that, you can end up with vertigo. The number one predictor for having vertigo is actually having it in the past. So if any of you have had vertigo, also called BPPV, then you can have it again. All right. Another type of vestibular disorder is called vestibular hypofunction. And this normally results after an event like maybe an ear infection or some type of an infection that's bothering the head and the ears, okay? It can happen on one side or both sides, but typically this kind of results in people saying, I feel like I'm on a boat, I feel like I'm unsteady, or when I'm walking around, I feel like I'm constantly veering to one side. This also gives us the characteristic explanation of, I don't want people to assume that I'm drunk when I'm walking down the street, because you just can't quite walk in a straight line. Then we have motion sensitivity. So this one's very, very common. That motion sickness that you know that somebody has, maybe you have it yourself, you don't have to live that way. That's actually a sign of a vestibular disorder. So motion sickness, feeling overwhelmed. I normally see patients come in when they say that, hey, I can't really drive anymore because I get too anxious, or I feel dizzy or sick or nauseous. When I'm walking down the aisle at the supermarket, I feel really overwhelmed. I feel unsteady on my feet, and I feel like I need to hold on to my shopping cart to make sure that I'm not going to fall. And that's normally because they're experiencing too much movement. And this really happens because the information going from your eyes to your brain, there's just too much of it. It's not well organized information. So we need to work on letting your eyes and your brain communicate a little bit better to each other. So there's that signature mismatch between visual and vestibular input. Okay. Then we have our classic impaired balance. And this can kind of happen, this is really common with aging, right? We start to feel a little less stable on our feet. Maybe you have diabetes and you're losing some of the sensation in your feet and your toes, okay? But this looks a lot like instability, having a history of falling or feeling like you're afraid you're going to fall, tripping on rugs and things like that, not getting your feet fully off the ground when you're walking, taking really small steps, a general sense of instability and unsteadiness, having to walk using your hands for support. So maybe if you're not already using a cane or a walker or something like that, actually when you walk by things, touching the wall, touching a couch or a countertop or something to ensure that you have a little extra balance, okay? And the number one thing this results in is lack of confidence. So just not feeling like you can actually go out in your community safely. Maybe you're not feeling like you can even move around your home safely, okay? So those are definitely big signs of impaired balance that we can work on, okay? And then the other big part of this is going to be the post-concussion syndrome, okay? So post-concussive syndrome normally occurs about 2 to 4 weeks after a concussion, so a hit to the head of any kind. This looks like, feelings of disequilibrium or dizziness, having that motion sickness or motion sensitivity where you just get overwhelmed by too much stimulus around you, being a little bit irritable, some difficulty sleeping, impaired memory and cognitive status. So you just can't quite pay attention like you used to. You can't remember how to do basic things, or maybe you're cooking and you can't remember the recipe that you just read, okay? This also shows as low activity tolerance. So you just can't do the things that you used to do because it brings on a headache or it makes you feel a little sick or things like that, okay? And I see this one a lot in people of all ages, but mostly athletes. This one really pertains to, younger people who want to get back to a certain activity after a sports injury, and they just can't. And then when you're looking at them in school, they're having a really difficult time paying attention, keeping focus, and keeping their grades up, okay? So those are all indications that you might have post-concussive syndrome. All right, so when should you get help? It's best for you to get help as soon as possible, all right? Are you feeling uncomfortable? Are you maybe feeling frustrated or nervous or feeling unsafe? Then come see us. Come get help. It's time to do something about it. Have you made any changes to your life? Have you limited yourself from your daily plans, canceled plans because you just don't feel confident enough to go about it, or you feel unsafe? Come see us, okay? If you're starting to lose your confidence and you want a little bit more independence, come see us. We're going to help with that. I really want to empower you to be the best and safest you, okay? And also, I want you to return to your usual activities safely, okay? And definitely reduce risk for falls. That's my special F word here. I don't like that word. No falls, okay? So when to get help, this is just a little summary based off of some of the diagnoses I talked about earlier. So looking at vertigo, okay? Come see me ASAP, all right? See me as soon as you feel it. If you wake up one morning and you get out of bed and you have that intense spinning, call me, okay? Call us. We want to help right away. The sooner you get in, the sooner we can treat it. And normally we can treat it in about 1 to 2 sessions, sometimes up to 4 sessions. So it's really quick. And you start feeling better sooner. You're not going to have as many falls and you can get back to your life, okay? These vestibular hypofunctions, so feeling unsteady like you're on a boat, okay? This is less pressing, but the sooner you come see me, the easier it is for us to recover from it and get you on your way, all right? Same with motion sensitivity. If you've been living with this for a long time, this motion sickness, come see me, all right? We can help you with this. If you're feeling bothered and you're having to adjust your plans because of these different things that you're feeling, it's time to come see us. Impaired balance. If you've had recent falls or any falls and you're concerned that you're going to fall again, immediately give us a call. I want to see you. We want to see you. We want to help you. Okay. If you're starting to lose that confidence and have that fear of falling, if you're worried about your safety, absolutely come see us. Okay. Post-concussion syndrome, like I kind of mentioned earlier, this normally starts to show up within 2 to 4 weeks after a concussion. And as soon as you start noticing those prolonged changes where you can't concentrate, you're having that irritability and it really isn't going away as quick as, your doctor kind of told you that it should, time to come see me. We can all help you out with that, okay? So how can we help? So just to kind of give you a little background, we provide professional and skilled assessments, expert diagnoses. We provide exercises and education to help you get over and understand your diagnoses and kind of what's going on and why you're feeling the things that you're feeling. And then we work through personal empowerment. So my number one thing is I want you to be able to return to your highest level of function, right? Improve your confidence and your understanding of what's going on so that you're not always going to rely on me. Some of these vestibular disorders, they're long lasting, okay? But it doesn't mean that you need me all the time for the rest of your life. I want to give you the tools necessary for you to understand what's going on and fix it yourself, okay? So we are trained to identify and treat a variety of vestibular balance and post-concussive disorders. Our goal as a team is to return you to your highest level of safe function via exercise, education, and personal empowerment. So what is vestibular rehab? I keep saying this, but what really is it? So vestibular rehab consists of adaptation exercises, substitution exercises, habituation exercises, and balance exercises. So we'll get into that. So what are adaptation exercises? So adaptation is essentially just encouraging the brain and the body to kind of get used to this new situation that it's in. Something has happened that has caused a permanent change. Well, we need to get used to it. We need to encourage the other systems of the body to get a little bit stronger so that we can work through it, okay? Primary recovery strategy to promote compensation, as I mentioned. The duration of this, normally we see patients for anywhere between 2 and 12 weeks. So it's a fairly quick turnaround that we can make these changes. Two main processes are occurring. You're reorganizing how the brain interprets information. And I'm also going to we're working on empowering you to reduce any anxiety and that fight or flight response that gets your heart rate going and makes you uncomfortable and stressed, okay? The exercise principle behind this is we want the exercise to be challenging enough that it's going to provoke a response. So it's going to make you kind of uncomfortable, make you dizzy, make you feel a little bit like you're going to fall, but it's not, okay? This is all within safe limits, okay? By doing that, we're expecting or having the body get used to that higher level of stimulus so that it learns how to handle it properly without it being aggravating, okay? Generally, adaptation exercises involve the eyes and how they move. So one thing I always look at is your vestibular ocular reflex, and that's just a fancy term to say how your eyes are moving and tracking an object compared to where your head is, okay? So let's try an exercise. Here's one of them that we commonly do here. I call this gaze stability exercises, but this is working with that VOR reflex, okay? So to start, I'm gonna have you think about your symptoms right now. If you have any eye fatigue, any headache, any nausea or anything like that, feeling unstable, rate it on a scale of 0 to 10, 0 being nothing, 10 being like, I need to sit down, I need to take a break. Then I want you to look at the very tip of the diamond right here, just a nice crisp focal point, okay? Looking at it, you're gonna start shaking your head side to side, no. You're not gonna do a full range with your head. You're just gonna go maybe 4 or 5 inches left and right, okay? Keeping your eyes focused on the tip of that diamond. Do this for about 30 seconds, all right? And I want you to notice, are your eyes getting more tired? Are you feeling dizziness or disorientation in your head? Are you feeling nauseous at all, okay? If those symptoms are changing and going up, then you would really benefit from this exercise, all right? I have you stop if your intensity of the symptoms go up a certain level, or if you meet this goal by doing this exercise for 60 seconds, I make it harder for you, okay? We wanna keep challenging the body so that it keeps making these changes, okay? In between reps, I'm gonna have you do something called grounding exercises. What grounding exercises are essentially techniques that reassure the brain that the body is actually stable and movement is not occurring. So this brings that system back down because we're making it a little bit aggravated. We need to calm it back down in between reps, okay? How do you do this? You're using different types of sensory input. So you're touching a countertop or sitting down in a chair. You're spreading your feet out so you have a little bit more of a stable support system, okay? You're tensing up your muscles, so your muscles can tell your brain, hey, we're not moving, we're standing still. Visually, you're going to look at something like a door frame or where the floor meets the wall. Your brain has seen enough of those objects to know that, hey, if I look at that, it's not moving, that means I'm not moving, okay? But the number one rule is don't close your eyes. If you close your eyes, that can make things a little bit worse and take a longer time to kind of come out of, okay? So these are awesome techniques. We use this all throughout any type of vestibular, balance, or even concussion therapy, okay? So substitution exercises. So this is another part of that vestibular rehab. So this is the principle of using an alternate sensory system for something that's already been lost, okay? So things are very similar within all of these exercises, but essentially I'm gonna be taking, say if you're visually dependent, I'm gonna increase the challenge of your physical sensation and remove some of the visual input so that you can gain more achievement in your other systems of balance, okay? So again, the challenge framework continues throughout all of these. I want it to be challenging enough to be aggravating, but not too hard that you can't do it, okay? So getting on to what I just mentioned. So if you're visually dependent, so there are 3 systems of balance. You have your eyes, you have your inner ear system, and then your muscular system, okay? A lot of us over rely on our visual system, but then as we age, our vision starts to go, right? My mind's already going. I already need to go back to the eye doctor for more new prescription. But balance exercises, when you remove that vision, suddenly now you have to use your inner ear system and you have to use your muscular system a lot more. Well, if you've been using your eyes for the last 40 plus years, it's really hard to get that other system to kind of kick in and cover the ground that's already been lost, okay? So we do different exercises to reinforce that physical sensory input by removing the visual sensory input, okay? And then vice versa, if you're losing some physical sensation, so say you have diabetes and you have some of the neuropathy starting in your feet, we need to reduce how much you rely on your physical sensation and buff up the other systems, so your inner ear and your visual system, okay? So here's an example of the exercise. So in this situation, her eyes are open, but we're challenging the physical sensations that she's feeling by putting her on an unstable surface, being the trampoline, and we're narrowing her base of support by putting her on 1 foot. So this makes this balance exercise really challenging, but it tells her brain that, hey, we need to rely on the eyes and we need to rely on the inner ear system a little bit more because we can't fully trust what's going on at the feet, okay? The last part of vestibular rehab that isn't just balance exercises is habituation. So the goal of habituation exercises is to relieve motion-induced dizziness or visual motion intolerance. How we do this is through graded exposure to provoking motor or visual tasks with the purpose of, again, producing those symptoms, okay? So again, we're practicing that uncomfortable task until symptoms are aggravated, and then we take a break. We do this a lot using optokinetic training videos, which I have an example of here. So if you need motion habituation, we need to do repeated motions that are causing that aggravation so you kind of get used to it, all right? And then visual habituation, when you're relying on those eyes too much, again, we're going to be using those optokinetic videos to train your eyes to organize that sensory information a little bit more and let you respond to it in a less challenging way, okay? So let me show you a couple of those real quick. This is one of my favorite treatment options. So I get really excited because I'm all nerdy about these things. So get that ad out of the way. Oh, hang on. All right. So this is one of the common visual sensitivity videos that I use. All right. It's a point of view video of somebody driving. And I have my patients either stand or sit and watch this. And again, you're using that rating scale of 0 to 10. You take in an idea of where you are at your baseline, and then you're watching this for about 30 seconds to a minute and seeing what symptoms are aggravated by it. If you start feeling dizzy, if I start seeing you sway side to side, that tells me that you're probably over relying on this visual input and you're not using the other sensory systems to reinforce the fact that you're standing or staying still. Okay, so here's this one, and then there's one other one. I use a bunch of different types, and it's all going to be based on what your symptoms are. Let's see, let's get that out of the way. If you tell me that you're having a hard time at the supermarket, well, there are a couple videos showing a grocery store and a supermarket and things like that. And you can see that this camera angle bounces around it a lot. That can be really aggravating. So if any of you are feeling kind of dizzy, feeling like you want to look away, you would really benefit from some of this training with us. Okay. Good. Let's head back to our presentation. Oh, bummer, hang on. Again, if you have motion sensitivity, bear with me for a second. Good. Okay. When we're looking at vertigo, so vertigo has a very simple treatment plan, okay? So what happens with vertigo is you have little crystals that are in your ear and they're microscopic. Sometimes those get knocked out of the place that they're supposed to be and fall into your semicircular canal, which is right here, okay? When that happens, when you move your head, those little crystals move with gravity and they cause a big wave flow of fluid that's within your ear. This signals the nerve that your head is moving, okay? The solution to this is we're essentially working the ear like a maze, and I'm putting you in a series of positions to walk that crystal right back to where it already belongs, okay? A lot of the times this can be solved within 1 to 3, 1 to 4 visits, okay? And you almost feel, a lot of the times after the treatment, you feel instantaneous change in your symptoms. Concussion therapy. What do we do with concussion therapy? We're using those vestibular exercises here, the adaptation, habituation, substitution, and balance exercises, and we're adding that cognitive component. So working on your memory, working on your problem solving skills, and then we add in these dual task exercises. It's actually one of my favorite things to do with patients with concussion syndromes is to give them a crossword. I'm going to check how well how many words they can get within a minute just standing. And then I'm going to have them go on a treadmill and exercise and get that heart rate up a little bit. And then once they're done exercising, come down and do the crossword again and see how many more words they can find. Okay. This gives me an idea of how well the brain is doing with its energy expenditure. You know, with exercise, your brain is using more energy. With these cognitive exercises, looking at this crossword, you have to do a lot of comprehension skills. Okay, so that gives us a lot of work, and this has been really successful in getting those people kind of over that hump of not being able to remember and not being able to recall things well. Okay. Another big treatment that we do that kind of makes our practice unique, in my opinion, is we do something called cranial osteopathy. So what this is it's a very gentle technique to kind of use these different bones in the skull, moving them to make sure that they move properly. So we all know that babies have soft skulls, those bones are impressionable. Well, when you get older, your skull bones are all still supposed to move a little bit. But what can happen after a concussion is you get a compression after that hit in the head that kind of gums up these joints here between these different colored bones. And that can cause increased pressure within the skull, all right? So what we do is a gentle technique to kind of encourage those bones to realign again and start moving properly. Another technique we use, which is unique to our practice, I believe, is this nasal release technique. And this is something that Dr. Jennifer Hobson does, who's also on our call. She specifically does this in our practice. What it does is it helps to, again, relieve those compression and clenching forces that have happened within the skull from the concussion or from a hit to the head, okay? What she's doing is she's actually inserting a small balloon into the nasal cavity and she's inflating it just a little bit, all right? What that's gonna do is expand and encourage those deep bones within the face to open up and expand. This is gonna release a lot of the pressure in your sinuses and in your brain, or around your brain that you might be feeling. The next part is our balance exercises. So I'm sure a lot of you are familiar with some of the things we do for balance, okay? This is where we can get really, really creative based off of what is making you uncomfortable. And we're going to tailor this specifically to you, okay? For some patients, we're going to be bringing out this agility ladder, and we might not go as hard as this athlete, but making sure that you can program where your feet are going in a safe way allows you to navigate different obstacles that you might not see coming. The other thing is going to be obstacle courses, being able to navigate different environments, like stepping up and down a curb, walking over grass, having to step over an obstacle, things like that. That's all really important, okay? Playing catch, using this rebound or standing on a foam surface where you have to catch something, kind of absorb that shock, balance yourself, and then throw something. I love this one. One of my favorite patients that I had, she said that she really wanted to play with her grandson. Her grandson was about 4 years old. He loved baseball. He loved playing ball and catching. So she wanted to be able to play with him, but she didn't feel confident enough to do that. So after a couple weeks of training, she was able to go out and play with her son and her grandson and feel safe. Okay. So another quick little overview. Here is our intervention summary. So if you have vertigo, we're going to be doing canalith repositioning maneuvers, so that walking those crystals back into place. If you have a vestibular hypofunction, so you're kind of veering to one side, walking like you're drunk, we're going to be doing a lot of adaptation exercises and gaze stabilization exercises. If you have that motion sensitivity, again, we're going to be doing habituation, both visual and motion. If you have imbalance, we're going to be doing a lot of sensory organization with balance exercises, working on your reactive balance and your anticipatory balance. Age-related vestibular loss, so that's going to be using all of those components of vestibular therapy, plus a lot of education, a lot of balance exercises, and I want to make you feel comfortable and in control of your situation, okay? And then concussion, we're going to be using that adaptation, the substitution, habituation, and cognitive exercises as well. The little asterisks I have next to a couple of these, this is just indicating, well, not so much the vertigo one, but some of these vestibular disorders are more progressive than others, so they're less stable. If the disorder is continuing to evolve and continuing to get worse, it might take a little bit longer for us to get a hold of it with therapy and make you feel better. Therapy is still always helpful. It just means that, you know, we might not be able to return you to the exact spot you were before the event happened, but we can definitely make sure that you're feeling safe and confident moving around in your community with your new sense of self. Okay. So what do you expect during an evaluation? So if you come in to see us, first thing I'm going to have you do is you're going to explain and show me why you're here. I really want to get to know you and what your problem is and what you feel limited with. Okay. Then I'm going to take a look at a couple things. We're going to take a look at your eyes. We're going to take a look at how your neck is moving, how you're walking, and what your balance is like. And then I want to see all those things that you told me are limiting for you. So what is making your symptoms worse? And then we're going to do a couple special tests just to make sure that we have everything documented well. All right. Once we do that observation portion, you and I are going to sit down and we're going to chat, or you and the other therapist are going to sit down and we're going to discuss and create an individual plan of care that suits your goals and your needs specifically. Okay. And then after that, we like to get you started on a couple quick exercises so that you can start feeling better immediately. Okay. Now today I only mentioned a couple of vestibular disorders, but that is not all that we treat, okay? Here's a list that's a little bit longer of a lot of the things that we're seeing. So we have experience here with vestibular neuritis, Meniere's disease, labyrinthitis, superior canal dehiscence, which is fairly rare, but we've seen quite a few cases of them, especially recently. Anyone who's recently had a stroke, working on balance and some of the sensory organization with them is awesome, okay? Age-related balance loss, traumatic brain injuries, multiple sclerosis, different types of dizziness. Your doctor might say it's related to your neck or other reasons. any type of cardiovascular or postural related dizziness, history of migraines. There are something called vestibular migraines that we work with as well. Something called persistent perceived postural dizziness. And then, of course, our general TMJ kind of facial pain patients and ringing in the ears or tinnitus that might cause you to feel disoriented as well. Again, here's the little asterisk saying these two specifically and cardiovascular as well. So MS, superior canal dehiscence, and cardiovascular related postural dizziness, those are considered to be a little bit less stable of a vestibular condition. So therapy is indicated, but slightly less efficient as with any of the other disorders and conditions. Okay. And you've reached end. So awesome. I'm so grateful you were here to talk with me. Do you have any questions? You can either insert your question into the chat feature at the bottom of your screen, or you can go ahead and raise your hand or unmute yourself and go ahead and ask your question, okay?
Hi, this is Alan Gorman. I've had I remember in 7th grade or something like that when they were teaching us to dance in gyms.
Yeah.
You know, every time I tried to do a polka, I'd get dizzy.
Okay.
Then I'd have to go sit down for a while, and I was pissed and embarrassed. At 7 years old, I couldn't use the word pissed, but I was.
Yeah.
And then, you know, if I even try to do that now, you know, it just wells up all over again.
Okay.
I don't know what whether it's a genetic thing. Is there something that could be done?
Definitely. So to me, that sounds like it's a mixture of coordination and motion sensitivity. Okay.
I have dyslexia big time.
Yeah. So that sending signals from your brain into your feet sounds like those signals are getting a little jumbled. Okay. And so, yeah. So not only is dancing hard because you're using different foot positions, but you have to think about it really hard. And then the balance is off. And your brain has to interpret so much information and respond to it that it can be really overwhelming for our system. So something like vestibular therapy for you and general balance therapy, I think would be really helpful.
Yeah. I also, I'm a neurofeedback clinician.
Great.
So, you know, I pay particular attention in my clients and consequently myself to accidents that I never paid any attention to.
Very good.
And I remember when I think it was 4 years old, maybe couldn't have been much more. I rode my tricycle down one flight of steps, and you know, my whole forehead was one crust.
Absolutely.
And you know, I'm convinced that there was some kind of brain trauma.
Yeah. It sounds like you definitely had a concussion from that one. That would be the right force of it, right? Having the brain come forward and hit, then come back and hit again.
Mm-hmm. Yeah. And yeah, so if that's something that you have the appetite to solve, I would love to see you.
I would love to see you too. I think it already sounds like, and just from knowing you for these couple of minutes, it already sounds like there are some things that we could definitely work on. All right. So yeah, absolutely. I would love if you gave us a call and set up an eval. I would really love to see you.
Should I get a doctor's referral for insurance purposes?
It always helps to have a doctor's referral. You can come in with just general direct access. And then as long as I have a doctor on file that I'll ask you, I will send the plan of care that we create to that doctor, have them look over it and sign off on it. And then that will be covered for insurance. But it does always help to have a referral just in case.
So that's the general. The specific is, you have my information on file. I see Manda's frequently. Send me a little note saying that this issue that I just described to you might be something you could help with.
Okay.
Now, my general doctor and, get a referral, which will cover my base on insurance.
Would you mind sending me a quick email at my email address listed right here? Just so that I have easier access to your information?
I can't read it. My screen, but why don't you just, oh wait, I see it. Andrea Dean at physiopartners.com.
Excellent.
Just hold it there 1 minute.
Yep. Can I open it up to others who have questions as well?
We're good. And you are
Perfect.
out of, I assume, 25 West Washington.
Yep.
Great.
We have 2 locations, so we're also at down in Lakeview as well. So we're at 2869 North Lincoln Avenue as well. So I go at both locations. We also have other therapists who do treat vestibular as well as myself too.
Okay.
Whatever works best for you. Okay.
Got
Pleasure to meet you. Thank you for coming today.
Sure.
Does anyone else have any questions?
Yeah. Can you hear me okay?
Yep.
So I was in a pretty serious bicycle accident while traveling in Italy about 3.5 weeks ago.
Okay.
Completely shattered my nose, broke my nose, had to be taken to the emergency room, and got surgery done to reset the nose. My eyes were following okay, so I don't think that they thought that there was anything seriously wrong with my head. But I'd say starting about a week and a half ago, I've been starting to get very dizzy, ringing in my ears, and it's just like it's hard to go to the grocery store and stuff. I'm still over here in Italy, so I'm just kind of wondering, I guess, like, who do you recommend in terms of like the next person I see in terms of like a doctor, or go to you guys? I'm gonna be back in Chicago in like a week and a half, but
Absolutely.
yeah, any kind of like feedback that you guys have would be appreciated in terms of like next steps.
Absolutely, definitely. So it sounds like with that dizziness, with having some of that motion sensitivity, that kind of post-concussion syndrome starting to set in, because you had that direct hit to the face, I would really recommend some craniofacial therapy to make sure the bones in the head are moving well. As soon as you have that direct hit to the face and the surgery, obviously we're going to let the surgery heal, but we need to make sure that those bones are moving properly so your brain doesn't have a lot of pressure and compression. Anytime I start to hear some ringing in the ears, I'm thinking that, the temporal bone, which is on the sides of your head here, are feeling compressed, and you have some inflammation and irritation that's causing that ringing. So I really suggest that, especially when you come home here, get in to see us. Let us start doing some craniofacial, at least immediately, and we can assess for any of those cognitive or dizziness changes that you're experiencing and get those going as well. We have a therapist here, both Dr. Hobson and Kathy Martinez-Reggs, who are specialists specifically with that cranial aspect of therapy, the osteopathy. I do some of it as well. I'm still under training, but I definitely want you to see at least one of them, as well as myself or the other vestibular therapists here. While you're still in Italy, if you're really struggling with it, if you're having that dizziness where you stand up and you get suddenly very dizzy and you have that spinning sensation, you can go to, I don't know the healthcare in Italy, but here it would be either a doctor or the emergency room, and they can generally do that canalith repositioning maneuver to make sure that that dizziness settles down for you. Otherwise, I would say try to look for an osteopath there who can kind of help with some of your current symptoms that you're having. All of that therapy we can also do here in Chicago once you get home.
Got it. Thank you.
Absolutely. Any other questions today? Okay, you guys have been an awesome audience. Dr. Hobson, are there any questions in the chat?
There are no questions in the chat, but there was a phone call earlier. Could you touch on vestibular migraines?
Absolutely. So vestibular migraines are a specific type of migraine that just really aren't responding to cervical work, so working on the neck and coming from the jaw. It's kind of a mixture of all of it, actually. And typically, when you have a migraine, it's going to present in this fashion where you're having that dizziness, you're having more motion sensitivity, you don't really tolerate being laying down or standing up. And this can be really incapacitating during the day. Not only is a migraine just painful, but suddenly you're feeling unstable and unsteady as well. This can also be sound sensitivity or light sensitivity. You're not able to kind of determine where you're at in space. So maybe you're doing okay, you have a headache, but as soon as the lights are turned on, all of a sudden you're unstable and you can't really navigate your house anymore. All of that indicates a vestibular migraine, and that is that can all be treated with working with the neck, doing some of the osteopathy, as well as doing balance and motion sensitivity exercises and vestibular therapy as a whole.
Thank you for explaining that.
Yep. Absolutely. Any other questions today?
No questions, but I thought it was a great presentation. I thought you brought things together very well.
Thank you. Thank you so much. I'm going to stop screen share for a second so everybody can kind of see my face. I really appreciate that. It's vestibular therapy is something that I'm very passionate about and I enjoy immensely. And I'm very hopeful that, I'll meet some of you in the very near future and we can get you feeling better and get you back to some of the activities that you love. Okay. If you know of anybody else who might be feeling any of the ways that we described today, go ahead and reach out to them and give them my number or something like that. I want to see them. I want to talk to them, and maybe I can at least point them in the right direction of how to take care of any problems that they might be feeling. Okay. All right. Thank you guys so much. I really appreciate it.
Wonderful presentation. Thank you, Dr. Dean.
Thank you. All right. Have a wonderful day, everyone. Okay.